Hello, everyone. Thank you for joining me today. My name is Faye, and I sell Medicare plans. Today, this is Medicare 101. There are so many questions around Medicare and what is Medicare and how can it be used and who should be getting Medicare that I just thought this would be an opportune time, since we're getting near the time for annual enrollment for Medicare beneficiaries, to spend a few minutes just talking about Medicare and the parts of Medicare and what a Medicare beneficiary's options really are. So, looking at Medicare, and you've heard people say, oh, I'm going to be 65, so I'm going to have Medicare, so then I won't have any worries whatsoever. Actually, that could be true, and it may not be true. And this is why I'm trying to explain and clarify what Medicare actually does and provides for an individual. So to do that, we start with, how does Medicare get funded? Where does the Medicare money come from? What is the Medicare fund? The Medicare fund for everyone who works and pays taxes, employer taxes, from those taxes that you paid from your check and from your employer's check. Those taxes go into the Medicare fund. Everyone who is a Medicare beneficiary and has Medicare in place, their Medicare Part B, they're paying a premium for. The Medicare Part B premium goes into the Medicare fund. So every time that there is a Medicare payment taken for Part B from your Social Security check before it is deposited, that money goes into the Medicare fund. Each member also has heard of the people who may have congressmen or politicians talk about what Congress is going to do or what they're not going to do with Medicare. That's because Congress also has a line item where they send money to the Department of Health and Human Services for Medicare. So the Medicare fund is made up of all those pieces. And from the Medicare fund, you, the Medicare beneficiary, can receive this red, white, and blue card, which gives you Medicare Part A and Medicare Part B. Medicare Part A has no premium if you are able to work for 40 quarters. They do not have to be consecutive, but if you work 10 years, 40 quarters, and pay into the Medicare fund, the Medicare taxes, then Part A has no cost for you. You receive that automatically. You receive Medicare when you become age 65, or if you are disabled before age 65 and collect Social Security disability payments for 24 months, you will receive Medicare. The Part B for 2021 does have a premium, and every year that premium is set by Medicare. It's not a choice of you, me, insurance companies, or anyone else. The Part B premium is determined by Medicare. Medicare picks the premium and Medicare sets the premium. So every year, sometimes around November, notices are sent out to Medicare beneficiaries to let them know what the premiums will be for the coming year. That's also the time that Medicare lets everyone know what their benefit will be for the next year. So now that you have Medicare A and you have Medicare B, Medicare A is for medical services for inpatient hospital, skilled nursing, private duty nursing, blood, and these are services that are all connected with inpatient except for home health care. For Part B, those are outpatient services. Medicare Part B are your doctor's office visits, lab services, x-rays, any services, surgeries that are billed outside of the hospital. So those are the two pieces that you're getting from original Medicare, the red, white, and blue card. Now, typically you may feel like, okay, I've got what I need, that's it. I don't need anything else. In actuality, that is not true. That is not the reality of what the original Medicare benefits will provide. Original Medicare provides those benefits, but there are deductibles, then there are coinsurance features involved in most of the benefits that you're getting from original Medicare. Your hospital has a deductible, and it's a per hospital admission. Your hospital has also, after the first 60 days, coinsurance. And after the 91st day, starting with the 91st day, you're actually paying hospital expenses, inpatient hospital expenses in full. For your Medicare Part B, you have an annual deductible, and then the plan pays 80%, original Medicare pays 80%, and you're paying 20% of those costs. Now, if you're fairly healthy and you haven't had any major things to happen and no chronic illnesses and no diagnoses, and you have a crystal ball that can tell you that you're never going to have these, then you're good. However, since you don't have that crystal ball and you have no way of knowing what medical conditions or medical diagnoses you might have, you have two options for choosing to use your Medicare benefits. Option one is to use original Medicare, use the red, white, and blue card, and purchase from a private insurance company a Medicare Supplement. The Medicare Supplement picks up the gaps that are in the original Medicare plan. And those gaps, that's why often Medicare Supplement plans are known as Medigap plans. The Medicare Supplement plans are all the same no matter where you find them. No matter which insurance company you're using, the plans are going to be the same. And they're known by alphabets. The most popular one is G. Plan G picks up all of the covered expenses, any expenses that Medicare approves but does not pay. keyword, covered expenses. So if your bill is $100, Medicare approves 80, and they pay 80% of that $80 bill, the 20% is then picked up by your Plan G after you meet the annual Part B deductible. Also, since each plan is identical no matter what company, the difference for companies for Medicare Supplement will be rates and services. So rates are generally depending upon the individual's age, their zip code, their gender. And there are certain periods when you can automatically get a Medicare supplement without answering any health questions. Today, we're just covering the basics of Medicare and what Medicare allows you to do and what benefits are available. So there are other things that you need to consider when you're choosing which of these options. And that's why it's critically important that you talk to someone who knows what they're talking about. You speak with someone who has had the training, who has the experience, who can guide you to the right program. Now, with the Medicare supplement and your original Medicare, you also need to have a Medicare Part D plan. And there are penalties if you do not choose to accept a Medicare Part D plan when you are first eligible. You are first eligible the moment you have Medicare A. So you do not have to have A and B to get a Medicare Part D plan. When you get Part A, you're eligible for a Part D plan. So if you do not have coverage through your employer or some other creditable coverage for prescription drugs, that's the moment that you should start to think about the Part D prescription drug plan. So if you were using original Medicare, a Medicare supplement, and a Medicare Part D plan, you would have 3 cards to use to access benefits, and perhaps three different ways of going about getting services, and at least 2 insurance company cards. So you'll have your Medicare card and 2 insurance company cards. It's doable. It's a way to go. It does not tie you to any particular network, no particular model. Whatever there is, wherever there's availability for Medicare services, then your Medicare supplement is going to pay. The analogy that I use for Medicare and the Medicare supplement is the truck and trailer on the highway, or tractor and trailer on the highway. When you see the large trucks from Amazon Prime or UPS or FedEx or any of the trucks that are carrying all the things that, truckers carry, you see the truck and then you see the trailer, which contains the goods. Well, the trailer cannot move anywhere unless the truck goes first. So the truck is the guiding force. In this instance, Medicare is the guiding force. The supplement will not go anywhere that Medicare doesn't go. So that's option 1. Option 2 is what's called a Medicare Advantage plan. With the Medicare Advantage plan, that plan actually covers the benefits of original Medicare Part A, the benefits of original Medicare Part B, and most often will include the Part D prescription drug plan. And these plans are only offered by private insurance companies whose plans have been submitted to Medicare and have been approved by Medicare to be offered in particular areas. So some companies are only in certain states, some companies are in states, but only in certain zip codes. And the Medicare Advantage plans, because they must cover what original Medicare would cover in Parts A and Part B, is a program that is approved by Medicare and is safe for you to consider. What you will see is that your out-of-pocket cost for premiums is lower. And why is that? Anyone who gets to this point in life and receives Medicare knows that there is no free lunch. So Medicare Advantage plans are not free, never have been, never will be. And the companies that offer the plans are not nonprofit organizations for the most part. Some of them are fraternal organizations, but for the most part, they're in business and they're running a business enterprise. So how does this happen that now you have an option that's available that gives you the benefits of Medicare Part A, Medicare Part B, and possibly Medicare Part D all rolled into one plan, and you're not paying a monthly premium? It's because from that Medicare fund, and that's why I thought it was important to tell you where the money comes from. From that Medicare fund, Medicare pays the insurance company, the private insurance company, to offer you the Medicare Advantage plan. Are there any questions so far? If you have any questions, go ahead and put them in the chat and I will answer them before we're done. But this is to explain the two options. Option one is original Medicare with the Medicare Supplement that you pay the premium based on your age and where you're located and your gender. And you purchase a prescription drug plan that fits the needs, that's going to cover the prescriptions that you're taking. That's option one. Option two is a Medicare Advantage plan that may have zero premium, so you don't pay a premium. You have co-pays when you use the services. And in the Medicare Advantage plan, you may have an option of an HMO or a PPO or a private fee-for-service. So those are the three options, and depending on what part of the country you are, those are the options that might be offered by the private insurers who have already gotten approval from Medicare to offer their plans. So thinking of those two options can be very confusing. That's why there are insurance professionals in your area who can help you with any questions that you have. When you want to know anything specifically about a plan, what does it mean? What does a network mean? Is your doctor in network? You should be working with an insurance professional who can help you to answer those questions and choose option one or option two, whichever fits your need. Now, don't think of this as getting married to a plan and that's the one you're going to stay with and live with and say, until death do you part. because that's not the case. Every year, there's an annual enrollment period for Medicare that runs from October 15th to December 7th. So if the plan that you chose is not the one that you really like and you need to change, you might change during that time. For anyone who chooses option 2 and you're not happy, you have an option to change between January 1st and March 31st. And then throughout the year, there may be other what's called special election periods that you can use to change your plan. Again, let a professional guide you to find what's going to work for you best. Don't sit back and just take it. Don't sit back and complain. Try to get the program that works best for you at the right time. Are there any questions whatsoever? Any questions about any of the information that's being shared today? Thank you all for joining. Evidently, this explanation has been clear enough so that all of the participants in this particular meeting understand the two options and the choices that you have if you are a Medicare beneficiary. This is Faye, and I sell Medicare plans. My telephone number is 407-340-6282. Thank you so much for joining me today.
Hey, before you go, because I thought you would be looking at the chat, I did put a question out there. You talked about Part G, unless I misunderstood, and I was looking for a slide on that.
I'm not familiar with the Part G at all.
Oh, okay, then maybe you said B and I misunderstood.
No, you have A, B for boy, D for David, and C, of course, is that combination. It's the Medicare Advantage plan. And in all my 20 plus years of doing Medicare, I don't know G. G is a plan, a supplement plan. It's a Medicare supplement plan. And I did mention Plan G, not Part G.
Okay, that is what I wrote.
Yeah, it's Plan G is the most popular.
But I thought I was
Medicare.
mistaken, and then I corrected. So that.
Okay, no, it's Plan G that I did speak about as the most popular Medicare supplement.
And do you have any info on that?
I have information on all of the options. Yes.
Okay. Well, that's something I'd like to see. And if, time today does not permit, we can do it another.
Okay, that's fine. We could do that. Today, we actually just wanted to cover the choices.
Okay.
And get you to know what the different choices are. But I will definitely follow up with you and be sure that you have the explanation for what the Plan G is.
Thank you.